glass of water or a seltzer. Glass of water, seltzer?
Water might be good, thank you.
Ice or no ice?
No ice.
No ice.
Yeah.
And Keith?
I take the seltzer.
Great. Okay. Monica, anything?
I'm fine. I got water.
You're good.
Monica, you say you're from Missouri.
I'm so nervous.
Oh, don't be.
Jay, I am.
Why?
Do you want me to call you John or Jay? Jay.
Whatever rolls off the tongue.
Can I do Jay? Okay.
Jay, yeah, Jay's fine.
Oh my
I
gosh.
go by Jay too. Jay's fine. Yeah, don't be. This is about you. And I tell all my interviewees, this is about you. This is your episode. Be as verbose as possible. Over-explain. Get it all out. I'm an interviewer, yes, but I'm a listener the best.
Okay.
So I'm trying to learn more about you. My audience or our audience doesn't know anything about you, so let it all out. My first question, you saw the questions, but I'm going to ask you, talk about your previous career and your career now. You have 35 years of public health experience, so just let it roll off the tongue.
Wow. But I loved all of that stuff. It was the hardest work ever. And I was always marginalized and criticized. But I knew that it was bigger than me. I wasn't there for me. I was there for the communities that I was to help. And I understood that very, very well. We built some amazing networks. We did our community empowerment network was a network of faith leaders, because I've always understood if you can work with leaders to give them tools, give them information, connect them to resources, teach them how to connect to the resources in their local community, then that's how you and it literally give them that leadership, put them in that leadership role and let them become their own health advocates. And that was always our work. We build the capacity of the community leaders to advocate for themselves, because I'm not going to be there 24/7. You're going to be there. You're the pastor. You're going to be there. And I want to make sure that when we leave you, you have some additional tools. And so that work was absolutely hard, but just phenomenal. And just to see how people who didn't even know that they could have an impact on their communities actually did. So I loved all of that work. As I said, my time with the Office of Minority Health was very, very meaningful. As I walk by the mirror, I pause out of curiosity. I look at the woman in the mirror, but I can't see her. I don't recognize her reflection. I don't recognize that bald head and weak eyes and broken smile. Yet, she's staring back at me. Who is the new woman in the mirror? Hey, mirror. Girl, you know you've always been my friend. For all these years, you always make me smile. So why are you being so cruel now? As I peer at the new woman, my eyes fight back tears. I want to turn away, but she won't let me. Mirror, please help me. She desperately searches my face for strength and courage. She can find none. So she reaches down deep in her soul, into my soul. And in the midst of despair, I finally see a glimmer of hope glancing back at me. As I gaze into her eyes, she wills me to embrace the new woman in the mirror. Her eyes beckon me to see. Her eyes beckon me to see the truth, my truth. girl is still me, just a little battered and worn from the chemo. My essence has not changed. In my soul, I am still loved, healthy, blessed, beautiful, and full of life. Finally, I stare at the new me and can see that she did something miraculous. She made me smile.
That was beautiful.
Thank you. Yeah.
Hello, everyone. For those of you who are new to my channel, welcome. And for those of you who are subscribed to Jay Speaks, thank you so much and welcome back. As you know, it is my mission, it is my passion to bring to you all conversation topics that are positive, motivational, educational, and informational. Today, ladies and gentlemen, I'm so happy to be here with Dr. Barbara Pullen-Smith, author, consultant, and entrepreneur. Dr. Barbara Pullen-Smith has over 35 years of public health experience. Her early career included community engagement, health advocacy, and lay health advisor work for organizations such as General Baptist State Convention of North Carolina and American Cancer Society. At the state government level, she has held many key positions during her 27 years in the North Carolina's Department of Health and Human Services, including founding director of the North Carolina Office of Minority Health and Health Disparities, which she held that position for 19 years. After retiring from the Department of Health and Human Services in 2012, she began to cater to her own community as an author, public health consultant, and entrepreneur. For 5 years, she served as a professor at a local HBCU, where she developed and coordinated an internship program for public health majors. As a public health consultant, she continues to focus on issues of diversity, health equity, healthcare access, health advocacy, and health disparities. And as an entrepreneur, her home-based business model builds teams that promote wellness, positive self-image, and cultural experiences throughout the world. Ladies and gentlemen, please sit back, relax, and most importantly, listen. And hopefully after today's episode, you understand for yourself that Dr. Barbara Pullen-Smith is a trailblazer, connecting people with resources in order to make positive change.
Okay. We're already recording, but we're going to make it official here. In 5, 4.
So, Dr. Barbara Pullen-Smith, how are you?
I'm doing great. Thank you, Jay.
How was your week so far? How's your day? How's everything been?
It's been pretty amazing, actually. We just had a great family celebration over the weekend, my husband's birthday. So the boys flew in to surprise him, and it was amazing. So
beautiful.
I have a lot to be thankful for.
When was the last time you've all been together? You, the whole family. You said the boys flew in.
Well, it's been a while. We usually try to take like Christmas vacation together. So it really been a while since all of us had been together.
Awesome.
Yeah.
And I was talking to your husband before the interview. So I think one of your boys are at Howard. Or
Yeah.
So what about the other boy?
The other one is in Texas. Yeah, okay. He's an entrepreneur, and I mean all the way. Yeah, he has he has his hands in a few different businesses, and so he loves it.
Beautiful. How does he like Texas?
He loves
Houston.
Houston.
In Houston. Okay, I lived in Houston for a little under a year.
Yeah, he was in it. He left Atlanta to move to Houston, and he said, "It's the Mecca, Mom. This is where we need to be."
Really?
Yes.
When he says we, as in like the family?
Yeah, that's what he says, that we need to be our family business. This is where we need to do it. So.
Okay. Well, before we officially get started,
sure.
I would definitely like to learn a little bit more about you, and I'm sure our audience will as well. So please, spell out, who is Dr. Barbara Pullen-Smith?
Oh, wow.
And, talk a little bit about your earlier career.
Okay.
I understand that you have, over 35 years plus of experience in the public health.
Oh, stop counting, but yes.
You're also an author,
yes,
entrepreneur. So please talk about your early career, your career now, however much you want to share.
Okay. Thank you so much for this time. It really means a lot to even have this opportunity to share. I grew up pretty much in rural North Carolina, northeastern North Carolina, a little town called Littleton. And I'm the youngest of 5, and my mom was widowed, and she had 5 kids from age 10 to 6 weeks old. I was 6 weeks old, and my dad passed away. So needless to say, I was raised by a very strong, resilient Black woman who understood the value of education. And so literally she made sure that even if we didn't see a lot in our surroundings, because we grew up very limited resources, but we had lots of love, and she had a great vision for us. And so she made sure that all 5 of us studied and was prepared to go to college because she wanted us to leave and to have a better life than she had. So she sacrificed a lot to make sure that we got that. So that was the blessing. She modeled some amazing behavior in that while I can't remember if I was maybe in elementary school, she went back to the community college to get her nursing certificate so that she could make a better life for us. And so the healthcare field was always a part of my life through her. And so when I left to go to college, went to UNC Chapel Hill, I knew that I would be in the health field, whether nursing and I ended up discovering public health. Amazing. So rather than having to take care of individuals, I learned how you help to improve the health of an entire community. That excited me. And so that's kind of how I got started in my public health career. After undergraduate at UNC Chapel Hill, I started working with Black churches, and that's always been a passion of mine as well, with faith leaders, because again, if you think about it, the church is about the one institution that we own as Black folk. And so working with Black faith leaders early in my career, just to help them to understand that yes, we have a lot of health challenges in the Black church or in the Black community, but the church can be a leader in helping to address it simply by offering healthy food options rather than just the fried chicken, have baked chicken, rather than, just the sweet tea. Let's offer water. Let's have salads. So we started that back in the 80s with that work with the churches. And from there, I went to the American Cancer Society. And that was an interesting, a very interesting time in my life as well. It had to do with fundraising, but it also had to do with just helping people to stop blaming themselves for situations that happened. So I talked to so many people, and they were, feeling guilty because maybe they smoked and they ended up with cancer or whatever. And I said, I tell you what, right now, let's not try to find fault or blame. Let's just figure out how we can help you. Because right now you need to focus on your healing. What's happened has happened. We can't change it. But let's do something about your future. Let's help you to live well. Let's get you plugged into the resources. So that time with the Cancer Society and just educating communities was amazing, in addition to fundraising. So I did golf tournaments and I did jail-a-thons and all those things to help the American Cancer Society to raise money. But the more important work that I did really was just tapping into people and helping people to know that there are resources to help if you need help. And don't be ashamed to ask. And we're not going to blame you for what happened. We're going to help you. And so from there, I started my career with the state of North Carolina with the Department of Health at that time, which is now the Department of Health and Human Services. And the first program I worked with was adolescent pregnancy prevention, and served about 33 counties out of 100 counties in North Carolina, right? And so, needless to say, I traveled a lot. I was all over the state, but helping communities just kind of get a handle on understanding how we can educate our young people about prevention, about, the values that they've been taught at home in terms of waiting, for marriage and all of those things. We taught kids, about how it's important that you focus on building your life and your career, and that the children can come later, and helping parents just to provide support and helping them to get resources if kids needed the resources, of course, in terms of making sure that their babies were healthy and providing some support systems for them. So I did that work for a while, then moved to health promotion for a while, and ended up landing in what was truly, I know, the career that I had. All that other work was preparing me to be the founding director for the North Carolina Office of Minority Health and Health Disparities. Without question, now that as I look back, all of that other was just preparation. As the founding director, I literally had, when I started, they gave me a box and a desk and the legislation that established the Office of Minority Health and the Minority Health Advisory Council. And they just said, go build it. I'm like, with very limited resources, of course, right? It's public health. We don't have a lot of resources. So the challenge was, number one, for me to figure out the vision for where did I want to see North Carolina go with this. And so I stayed in that role for 19 years. And that work truly defined me as a public health professional. And I used to laugh all the time. I said, well, you can't tell me I'm doing it wrong because no one has ever done it before. So I get to kind of make mistakes. I get to do it. I get to try this and see how things fall out. So our focus really was on policy changes, because we knew that if we could get legislation in place, the money would come, right? So we worked on passing legislation that could literally address and be targeted for racial and ethnic minority populations. We worked with the State Center for Health Statistics to document the differences in health status by race and ethnicity. And it was done under a whole lot of scrutiny and pushback, because part of, if it's not documented, it's not real, right? It's just people talking and complaining. But we made it very crystal clear, and we made it very real. And we took the data and worked with the State Center to tell the story of health status by race and ethnicity too. So it wasn't just, just what's happening with minorities. It's what's happening with American Indians, what's happening with the health status of African Americans, what's happening with the Hispanic Latino population, because at that time, that's when the influx of the Latino population really was happening in North Carolina. So we had to address that community as well, even though they were new to us, we didn't really understand, but we work with them to learn. And so telling the story, documenting was a big part of the work that I did. And I was very proud of that, because we did the first, I would call them like focused reports by race and ethnicity. We did the very first health disparities report card. And the report card was an amazing tool, because working with the State Center experts, like Delton Atkinson was one of the leaders at that time. And we literally had them to help us to grade the health status outcomes for like hypertension, diabetes, kidney failure, HIV/AIDS, and had them grade them by race based on, all of this is based strictly on data. And it was our way of interpreting the data. So I would say to communities, it's not important that you understand the rate per 100,000 population. If you understand that we are getting a D in diabetes when it comes to the Black community, but there's a B for the white community in terms of health status outcomes, that's the message. If we're failing for HIV/AIDS for the African American community, but we got a B for the white community, that's all you need to understand. Because if D's and F's are unacceptable when it comes to education, if a kid gets a D or F, they're failing. Well, the state was failing. That was the whole message with the Health Disparities Report Card, that the state, you're failing. You're failing us, you're failing our communities, and what do we need to do? So using the data as the driving force and the tool to advocate for funding, to say, well, we need resources here, that helped us. It pissed a lot of people off, but it helped us to be able to move with integrity to say, we're not just screaming and crying because we don't like it. We're screaming and crying because it's wrong, and we're screaming and crying because healthcare really should be a right for everybody, not a privilege, just because you have more, right? And so that work with the report card was amazing. Some of the other work that I really valued, we worked with the public health system. As I said, that was when the influx of the Latino population was happening. We were not prepared. Public health was absolutely not prepared at all to deal with the Latino community. So you had situations where in some situations, they were having the children to interpret for the pregnant mom. Totally inappropriate, right? In some cases, they were just not seeing people because they said, well, if you don't speak English, we can't serve you. So we had to really work with the state health director at that time, Dr. Levine. He was livid because he knew that was against every law and every policy for public health. And so we went through this whole thing of working with them to hire interpreters or having access to interpreters, even by phone, so that if the health department did not have an interpreter available, there was a number that they could call and would get access to an interpreter, and they would have the phone on speaker, of course, so that the provider and the patient could both talk to each other. It was kind of rugged, but it worked. It worked until we built that capacity for local public health, for example, to hire more bilingual staff. And so that kind of helped to drive that kind of work as well. But I loved all of that stuff. I mean, it was the hardest work ever. And I was always marginalized and criticized, but I knew that it was bigger than me. I wasn't there for me. I was there for the communities that I was to help, and I understood that very, very well. We built some amazing networks. We did our community empowerment network was a network of faith leaders, because I've always understood if you can work with leaders to give them tools, give them information, connect them to resources, teach them how to connect to the resources in their local community, then that's how you and it literally give them that leadership, put them in that leadership role and let them become their own health advocates. And that was always our work. We build the capacity of the community leaders to advocate for themselves, because I'm not going to be there 24/7. You're going to be there. You're the pastor. You're going to be there. And I want to make sure that when we leave you, you have some additional tools. And so that work was absolutely hard, but just phenomenal. And just to see how people who didn't even know that they could have an impact on their communities actually did. So I loved all of that work. As I said, my time with the Office of Minority Health was very, very meaningful for me. And so I retired after 27 years with the Department of Health and Human Services. My last 19 of those was with the North Carolina Office of Minority Health and Health Disparities. And so once I retired, I said, right. And then after a very short time, I was approached about doing some consulting work. And so I retired in 2012. So I've been retired for a minute, which is what I had always planned. And so I started doing some consulting and have been doing that work now since 2012, literally. And I work, like right now, I have two of my favorite projects. One is with a network of faith leaders, of Black faith leaders in the Charlotte area. And the project is helping the Black community to overcome stigmas around mental health. It's not just the Black community, it's underserved populations, but we've mainly focused on the Black community, but we never exclude anybody, but underserved populations. And it's working with the faith leaders to train them, working with their members of the congregation to give them additional information to understand that we pray for everybody, but there are people who need to be plugged into another system. They need to be with a therapist. They may need medication. And that's not, so we don't expect the pastor to be the end all, to be all the end all for everybody. So we want to make sure that they know how to refer. And the grant, I was blessed to be able to write the grant with a colleague of mine at UNC Charlotte at that time, Dr. Richardson, and now she's at UNC Chapel Hill. But that grant has been amazing because we wrote in the grant enough funds so that when people need to go to mental health services, that we've paid for up to 10 sessions with a therapist. And we contract with the therapist to make sure that those resources are there. And again, this is all about eliminating the barriers, eliminating the stigma, eliminating the barriers to access to needed mental health services. And it came at a time in response to COVID. So the timing was perfect in that we got to say to the state, people are struggling, they're depressed, they've been isolated, and they need some support to get access to mental health services. And that's kind of how we did it. And that project just finished its third year, and we're starting the fourth year right now. Love that project. And the results have been amazing. It's been well evaluated now it's being evaluated by UNC Chapel Hill. It was UNC Charlotte, but Dr. Richardson came here, so she brought that project with her. The other project is also fascinating in that it is home blood pressure monitoring to help address disparities again. And it's really just helping average people we provide a blood pressure monitor for them. And they are, we request that they take their blood pressure, a few times a week. Every time they take the blood pressure at home, the results go directly to the clinic with the clinic where they go for their primary care services. So the doctors have access. And then and the pharmacists have access to this information as well. And then we have research coordinators who actually help to be the person to shepherd the person through this process. So the research coordinator calls and contacts the individual and meet with them on a regular basis, 6 months, 12 months, and that kind of thing, just to make sure that they're doing okay with their blood pressure monitoring machine. So I love that project as well. And we're in year 3. We're finishing up year 3 of a 5-year project with that. So those are the things that have been keeping me busy since 2012. I volunteer, I do a lot of volunteer stuff too, but I'm sure we'll talk about some of that later.
Absolutely.
Yeah.
Wow. First and foremost, thank you so much for taking the time to spell all of that out.
Thank you.
Sounds like a very fulfilling past life and current life. Like you said, you're still doing volunteer work and you're still doing consulting work.
Mm-hmm.
So, okay. With regards to the North Carolina Office of Minority Health and Health Disparities, you said that you passed policies or you helped pass policies. Care to share a little bit more information on what policies were successfully passed through your administration?
Sure. I would say one that I am, I guess I am most proud of. We were able to get legislation passed that allowed us to give funding to American Indian tribes, faith-based organizations, as well as other nonprofit organizations. Now, the faith-based organization was the big deal, a huge deal. And I'm sure some legislators woke up and said, we really passed that? I'm like, yes, you did. But that opened the door so that we could access more Black communities because if you didn't, so think about it like this. If we knew, we went, but used the data to help us decide areas that we wanted to target or areas where we needed to focus because the data says, people are dying at higher rates from whatever here. We need to be able to take those resources there. Well, what if that community didn't have a minority-owned, minority-led nonprofit? We had no way to give them money, except that legislation opened the door because now churches were eligible to receive the funds from the state. So that was one that I was very, very proud of for sure.
Was this like a one-time payment or was this a continuing payment?
It was ongoing. It was ongoing. It was ongoing. We would fund the grants for like 3 years.
Oh, wow.
It was amazing. Yeah. And some we would continue the funding. But the key was training people to understand you never depend on one source of funds. We're going to give you some money to help you get started. You have 3 years to figure out how to leverage other dollars so that you can continue this program after the state funding is gone. So that was part of what we were doing as well. It was more than just giving them 3 years of funding. It was helping to build their capacity to continue the work even after we were gone. So that was the whole deal.
And I assume that they were successful with that.
Some were, and some were not. Some of the organizations that we worked with many, many years ago are still going. So that just really blesses me for sure.
Awesome.
Yeah.
And then you also mentioned that you were really privy to the data that on how you were impacting the respective community. Do you remember any data points like of the before and the after?
Nothing really comes to mind because realistically, it would take a whole lot more than just the resources that we had in the Office of Minority Health to ever change the statistics for the state, for an entire community or entire county. Because most of the time the data was reported county level as opposed to like community level. So it's not anything that we could take credit for, even if we saw reductions in, because we were just, think about it like this, we were just one corner. We were just chipping away in our corner to help people to understand that they can live well. When they know how to come together and leverage the resources in the community. I used to tell them all the time, if the health department is not reaching out to you, then you need to reach into them because it's your tax dollars that pay their salaries. Don't ever forget they work for you, just like I work for you. Yeah.
Wow. Makes sense. That makes sense.
Oh yeah.
You gotta be proactive.
And that's the whole thing. It's about using your voice to speak up and ask for what you need and to understand what your position is as a taxpayer in the community as well. So
do you believe that people were nervous to do that because they didn't know that they had the power, or they were just afraid to speak up, or both?
It was a combination of those things. if you've been socialized to think that that if people don't give you something, then you don't necessarily have a right to ask for it. They didn't know that they had a right to ask for those services. And I think that was part of, to me, that was one of the most enlightening parts of the job and the work that we did. It's like, oh, no, we work for you. As a state employee, I work for you. As a local public health employee, they work for you. And you have a right to ask for the services that you need. So, pastor, if you've not asked them to come and help you to do some blood pressure screening or whatever, then you have a right to do that. And it's not going to cost, it shouldn't cost you because you've already paid them. They work for you.
Now, I understand that we as a people need to be better and proactive of, asking for help. Yeah. But do you believe that the state could do a better job with letting its people know, like, we're here for you?
Oh, absolutely. Oh, I definitely think that they could do a better job. Yeah. And you can just think about it. I can think about many programs and say, well, yeah. I used to also tell a lot of people when they would call, because they would call the Office of Minority Health because they were just so frustrated because they couldn't get through the system and to figure out who they needed to talk to. And I said, if you understand this, the systems are pretty much designed to protect themselves. If you're able to get services from this system, then count your blessings, because the system is not designed for that. The system protects itself. Why else would you have to go back year after year to prove that you're still poor to be eligible for Medicaid? Come on. It's crazy to me. But that's what all the time, we would say that all the time to people. The system is designed to protect itself. So let's help you figure out how you get what you need out of this system. And it's not fair and it's not right, but you can sit there and complain and stay on the outside, or you let us help you to figure out how do we maneuver to get the services that you need. How bad do you need it? Yeah.
Yeah, I can see how that could be very frustrating.
Oh, it's frustrating. Even it was frustrating for me, and I was inside the system. So, oh God, oh yeah, I knew how frustrating it was for people, and I would tell my team all the time, don't be like everybody else. Don't just refer people to a number and no one's going to pick up and help them. That's crazy. By the time when they talk to us, I want us to be the person, the agency, where we can at least do a warm handoff to somebody real, to somebody else in that other department, whether it's in mental health, whether it is in Medicaid, whether it is in the diabetes program. Don't just be giving people a generic number. Let's get them to the contact person, to the resource that they need. Yeah.
So what was the most challenging part about being a public health professional and a public health consultant?
I would say the most challenging is probably understanding how big the need is and then looking at the limited resources that you had. So that's the challenging on the negative side, right? Because the problems were always bigger than any resources we ever had. But the challenge on the positive side was knowing that when you build up people and help people to learn how to change their lifestyle and to influence in a positive way their family members, to change their eating habits and those kinds of things, or lifestyle behaviors, that's a great challenge. I'll give an example. One of the projects we worked with was with the public housing community in Wayne County in Goldsboro. And we started out with the public housing thinking that we would do some, healthy food demonstrations. We did some like physical fitness. We did like Zumba classes. And so, but that, again, time-limited project, right? We had to fund for a time limit to the limited time to give them. So the leaders in that public housing community flipped the script. They said, we don't need for you to be having someone to come in from the outside to teach us Zumba. We're going to have one of our own to be trained to be a Zumba instructor. They did that. And they said, well, we want to put together, we want us to plant a community garden here on our property. So they worked with the administrators of that public housing community, and they gave them a plot of land beside one of the buildings, and they had a community garden. And the kids would water it. It was so beautiful. And the kids would water it, and they would kind of protect, the garden and stuff. But that was so successful. They ended up growing vegetables, and they sold it at the market. It was like they took our little idea and just made it their own. And that's what I mean when you give people the tools, the information, access to how to do it, and they take it on. That's a beautiful challenge as well in terms of how you can help people to help themselves. And I just absolutely love that project. Yeah.
And that goes back to what you were saying before. You said something along the lines of, instead of taking care of people, you take care of a community, something like that?
Right. So, yeah, that's how I got so excited about public health and moved away from just clinical care as a nurse. I wanted to influence the population's health. That's what public health is. Mm-hmm. Yeah. Yeah.
And I know that particular case, was that more common or was that like an anomaly?
The case with the public housing community? That was totally anomaly.
Oh, really?
Oh, yeah, yeah.
So that most of the time...
Yeah. Oh, yeah. Oh, yeah.
Interesting.
Yeah.
I mean, it's not funny, but it's interesting.
No, it's interesting, yeah.
So I got to ask you, another thing that was very interesting that you said, the report cards. Mm-hmm. How you mentioned how some cultures, some races got different ratings.
Yeah. Mm-hmm.
And I think that ties into health equity.
Yes. Yeah.
What do you believe is missing from health equity?
Missing.
If anything.
I guess I would say a broad scale acknowledgement that it exists is what's missing. Because most people don't want to spend time understanding what the data is saying. People want to think that everybody's being treated equally and fairly in the system. Of course, no, it's not true. It's not real. And it's very well documented. So I would say that's it. That's what's missing. Just acknowledging that it's real, that it exists.
So who, from your experience, who do you believe doesn't believe that it's real?
Great question. Let me just say like this. The research is very clear about things like implicit bias. Okay? I'm going to give you an example of what implicit bias looks like in the healthcare system. And so if the provider, okay, let me give you a scenario. One scenario that is forever etched in my mind. My chemo partner, her name is Tammy. She happens to be a Black female. Her doctor was a white male. And so they had done her annual mammogram. And there was a little spot, just a little area that was detected, and he was kind of waffling, well, maybe we should just watch it. Maybe we, just kind of wait and see. And she asked the question that flipped him on his head. And she said, what if I were your wife or your mother, what would you do? He says, oh, no one has ever asked me that question before. He said, I would do the next step and get it tested. She says, that's what I want. Yeah. it's an example. It's documented that even pain management is not treated the same in the healthcare system for people of color. I mean, so there's so much evidence that shows that there are so many inequities, and yet you don't hear about that, right? Mm-hmm. You don't hear about that because people want to think that everybody is being treated the same and everybody's getting the access. The lack of access is one of those things that's so crazy to me because I'm like, are you kidding me? So think about it like this, just in the current environment. And I'm not going to get too deep in the current environment because it's too emotional for me. But between September 2023 and December 2023 and September 2025, there were about 670,000 new people enrolled as a result of Medicaid expansion in North Carolina. So what's happening now? What's the discussion now? About what? Cutting, reducing the Medicaid program. Now, do you think that's going to cause some inequities? So it's so real, it's so big, and yet it's not. Yeah, people don't talk about that. Yeah.
No.
They don't talk about it.
You're going to say something else?
No, I'm going to leave it alone. Because it's too hard. I mean, it's hard for me to watch.
But it's reality.
It's just heartbreaking for me to watch this. Yeah. Because from having been inside that system and knowing how challenging it is already for people to get access to services that they need, being poor is really one of the greatest predictors of poor health. And so then if you think about it, the disparity is poverty rates, North Carolina, white population 9%. Guess what? For the Black or African American population, 19%. Twofold. So you see that it's there. It's inherent. It's already there. The inequities are already there.
So is it safe to say that you agree that health disparities are caused more by social determinants of health than biology?
Certainly genetics play a role, right?
Mm-hmm.
But being poor is one of the greatest predictors of poor health. So I would just say that it's a combination of things. It's certainly some genetics, and of course it has to do with lifestyle. It has to do with environmental exposures. It has to do with a whole lot of factors for sure. But being poor is one of the greatest predictors.
And the social determinants of health, over time, they do affect your biology.
Oh, absolutely. That's right. And that's the whole deal. And that's the connection right there. So, yeah.
Wow. So when it comes to, I guess I know your answer for this as well, too, but when it comes to health,
I'm going to let you answer this one.
Do you believe...
I'll take a break. I'll drink some more.
No, drink, please. Mm-hmm. The healthcare system, do you believe it's getting a lot more about money versus genuine care? About profits?
Oh, well, I think it's always been a business first. Mm-hmm. It's been a business. I mean, I don't think that's... I just think that it's a business. It's definitely a business. Not to take away at all from, there are providers, there are people in the healthcare system who still care. Of course, you can't do a blanket statement about that. I just think that there are so many gaps in the system, and so there are people who are underserved, who don't have insurance, who don't have access. I think the gaps in terms of the system is what's hurting so many people too, because if it's a business first, think about it. When you go to the doctor and you check in, they ask your name, and then what do they ask you? You have your insurance card? Let me see your insurance. What's that? Not, Jay, how are you feeling today? What can I do? What's the problem? You think about that. That right there is the message. To answer your question, that's the message. It's a business. Dang. And if people can get care, then God bless them. I tell you, if you have success, I say that's great. If you are in an environment and the caregivers actually care, oh man, you better count your blessings for sure. I'm serious. Yeah, I just think the system is pretty, I think it's spiraling down without question. Without question. And then, the cost of medications, the cost of everything is going up. So it's like the same people are still poor. It's still 9% versus 19%. How do you reconcile that?
It doesn't make any sense.
It doesn't make any sense.
It hurts my head. And
yeah, right.
I don't even know how it makes sense to the doctors, let alone the medicine companies. But again, it's all about profit over people. Oh gosh, I don't want to get distracted.
I know, right? Let's talk about something else.
So
I get too emotional.
No, it's a lot. It's a lot for sure. So I do notice, recognize that in your intro, you skipped over something that was, I guess, pretty important in your life, your diagnosis.
Yeah.
I don't mean to pry. Do you feel comfortable talking about that?
Oh, of course. Of course.
Because you talked about the American Cancer Society.
Yeah, I did. I worked there. And so, that was. So, the burden of cancer in my family has been unreal. So, I'll sum it up like this. By the time I received the diagnosis in 2015.
So after you were retired?
It was right after I retired, right? And I had lost my mom to breast cancer, and she was 75 when she passed away. I had lost my sister at age 52 to breast cancer. My older sister had been diagnosed with breast cancer, and but she's still a survivor today, 17 years, yay. So grateful to God for that. So by the time 2015 came and I received the diagnosis, I had gone through all of that burden and all that loss and all of that, just watching the devastation. So I was completely overwhelmed just to hear the words directed at me. And I call myself, the public health professional, know the system, understand the terminology. When I was diagnosed, Jay, I was lost. I didn't know anything. And I would be so angry because I would be talking to clinicians. If they knew my background, they would be using all these terms. I said, hold up. It's not that I don't understand it. I'm helping the next patient. I'm not impressed. I'm not impressed by how smart you are in using these big terms. I want you to break it down like a sixth grader. You're talking to a sixth grade kid right now who's scared. I want you to talk to me like that. So I want you to define everything you just said in layman's terms so that I am clear. Because it's one thing to talk about cancer, and I used to teach about it and all that stuff. I'm a health educator by training, right? So I used to teach about all that stuff. But when it came to me, I didn't know a thing. It was absolutely overwhelming. And I went through a year of hell, and I tell people, it was a year of hell, but I survived it, and that's made me strong and resilient. And so in life, you choose, right? You can choose how you respond to stuff, and you can take that pain and you can make something out of it, or you can just wallow in it and kind of stay in it. And I just chose to bottle it up and figure out what can I do to help other people to get through it. Now, every experience is different. That's the whole thing, because when people, one of the things that came out of my pain was the book, my book, The New Woman in the Mirror. But people experience pain and differently, right? And so I said, well, I journaled throughout that journey for me in terms of from the diagnosis to what I call my healing. And some days I would just write too sick to write. It's just that. It was just those days. But I took the journal and really developed the book as a way to help me process my pain and to help me to heal from having gone through hell. It was hell because I had to go through the whole thing. It wasn't, some people don't have to do the chemo. I had to do the chemo. I had to do the surgery. I had the radiation for it. And I had to do infusions for a whole year and all that. I mean, so for mine, it was tough. Not everybody's experience, praise God for that. But the book, I wrote it so that it chronicled not only my journey, but it leaves room for the reader to write their own story along with me. Because the healing for me came from writing. The healing for me came from me being able to talk about how awful I felt on that day, or how it was so hard for me to go out in public with a bald head. I mean, so that was how I helped myself to heal through that. So that's what the book is, The New Woman in the Mirror.
Wow, thank you. So
yeah.
Curious, did you journal before this?
Oh, yeah. I've been journaling since I was a teenager. Yeah. And I write, I call them expressions. And so I write about pains and passions. Yeah, but I call them expressions. And so this book reflects what I call expressions. And I did it like this as opposed to long narrative because I didn't think it was helpful for me to share, I had to go to do 30 rounds of radiation treatment. That's not helpful. But the feeling and the experience of going and even being set up and marked to get radiation, that's the part that I write about. Do you see the different perspective? And so, that's why I formatted it the way I did. Yeah.
How long are your entries?
Not very long. Some, some are a page, some are shorter. It just depends. Yeah.
Do you mind reading an entry?
Okay. Let's see. Do you want me to read the cover?
Whatever you feel like
Sure.
sharing.
Okay.
Yeah, please.
Okay. I'll do the title. It's New Woman in the Mirror. As I walk by the mirror, I pause out of curiosity. I look at the woman in the mirror, but I can't see her. I don't recognize her reflection. I don't recognize that bald head and weak eyes and broken smile. Yet, she's staring back at me. Who is the new woman in the mirror? Hey, mirror. Girl, you've always been my friend. For all these years, you always make me smile. So why are you being so cruel now? As I peer at the new woman, my eyes fight back tears. I want to turn away, but she won't let me. Mirror, please help me. She desperately searches my face for strength and courage. She can find none. So she reaches down deep in her soul, into my soul. And in the midst of despair, I finally see a glimmer of hope glancing back at me. As I gaze into her eyes, she wills me to embrace the new woman in the mirror. Her eyes beckon me to see. Her eyes beckon me to see the truth, my truth. Girl, it's still me, just a little battered and worn from the chemo. My essence has not changed. In my soul, I am still loved, healthy, blessed, beautiful, and full of life. Finally, I stare at the new me and can see that she did something miraculous. She made me smile.
That was beautiful.
Thank you. Yeah.
A little bit of poetry in there, too.
A little bit. So I got a little poetry. I got a little something in there. A little something for everybody.
So how long would an entry like that take you?
Oh, man.
Did that come to you like naturally? Like, are you fluid with writing, or do you kind of have to like stare into space and kind of get...
I do a little of, sometimes it flows and other times it doesn't. So for me, I, like during this journey, I just knew I needed to try to process everything that was going on. So like I said, now that I may have written some sketch notes that day about, I didn't even know who I was when I looked in the mirror. And that's what came. But then when I went back to write this, then I flushed it out into this. Does that make sense? Mm-hmm. So my journal notes didn't say all that. No. My journal notes did not. But my journal notes picked the point of pain. And that point of pain was looking at someone I didn't even know who she was, and it was me. Yeah.
Wow. Yeah. So you said hell was a year for you. Mm-hmm. So this book took you a year to write?
It took me no, I didn't even start writing this until after I had gone through and really started healing pretty well. So I didn't publish this until 2019.
And you were diagnosed in 2015.
And I finished everything like 2016. 2017 was a year of recovery too, because people think once the treatment ends that you're now ready to go. No, it really is a very long process.
And you said that you finished it in 2019 or you started in 2019?
No, I published in 2019. So I wrote...
So you were journaling during 2015 to 2017?
Yes, and then I wrote this pretty much 2018. I probably focused more in terms of, I think I'm going to put it in a book. Maybe 2018, yeah. 2017, 2018.
So I got to ask.
Sure.
Do you believe that writers are born or made?
I think there are people who have the gift of gab, of course. But then there are people like me who discovered that if I write it, I'm a natural introvert. So that's the deal, right? So for me, writing is what I found all those years, even as a teenager, that helped me to understand the world and help me to process my feelings and all of that. So I think it's both. I think some people are born with that gift, and I think others develop it out of necessity. And for me, it's out of necessity.
Out of necessity. So you don't come from a family tree of writers?
No. My sister was a journalist with the LA Times and Washington Post. I mean, so she was big time, right? So she was the smart one. She was definitely the smart one. But no.
Do you have any other books in the future, or is this?
Yes, of course.
Of course.
Yeah, I've published other stuff, but not another book. I mean, just articles and stuff like that. But I am, I've been trying to wrap my head around what's the next story I want to tell, which aspect of the whole journey that I want to tell. I was thinking about from the caregiver's perspective, because that truly, just having family support, having a network of people in the community was family, was my faith. It was my faith, it's my family, and a community that really helped me to get through. I mean, I'm grateful that my mom taught me about the love of God and the strength through Jesus Christ, and just understanding that power and connection, because that helped me as well to get through it. So taking the pain, the book was one way of processing the pain, going through it. And then 7 Black females who are all breast cancer survivors, we got together and started a nonprofit, Sister to Sister Alliance. And we've been in existence now. October was 4 years. Yay. So we're really proud of that. We're a breast cancer awareness and support organization. So we do support groups monthly. We raise money to help women who are uninsured or underinsured pay for mammograms. Again, trying to reduce access barriers for underserved populations. in the Wake County area and beyond. And I also, out of this book, started a forum, Living Circles Around Cancer. And that's really just a way for people who've gone through cancer experience, not just breast cancer, but cancer experience, to have a safe space to kind of talk about the feelings, the emotions, because when you go through any trauma, it's not just, mine just happened to be this, you have to fight on all fronts. And, you have to fight spiritually, you have to fight physically, mentally, and emotionally, right? So giving people a forum to kind of work through some of those emotions, unexpressed emotions and pains, has been so rewarding for me. I started the Living Circles Around Cancer Forum last year. And that's been very, very fulfilling, very rewarding. And then I also volunteer with the American Cancer Society with their Voices of Black Women project. So they are literally doing this this study over a number of years and trying to learn from Black women ages 25 to 55 about their experience in America and how come you're so resilient? What have you experienced in your lifetime? And just really trying to understand who we are as Black women in America. And I'm so excited about that. I think it's brilliant. And I love that the scientists who requested this study happen to be Black females who work for the American Cancer Society. So it's a pretty powerful study.
Wow.
Yeah. So
That's
I like
awesome.
that. Yeah, it's pretty powerful. So it's a lot. I mean, it's a lot to do. And so I'm just grateful to be able to do any of that. Can I plug my website?
Yeah.
So the website is barbara.pullen-smith.com, and you can learn more about, well, certainly about the book, but also about the Living Circles Around Cancer from there as well.
Awesome.
Because I'm gonna probably schedule some more in the spring.
So for our viewers listening, are there any proactive measures that someone can take to prevent breast cancer from happening, or?
Man, I wish there was an easy answer to that. I really wish we.
If it's in your blood, is it? I guess the chances are high.
Well, I guess I wish
Or
there
if
was
in
a
your bloodline.
Yeah. It's interesting because I told you about the family history.
Mm-hmm.
Well, mine was not genetic, so I took the test, and it was not genetic. So if it's not even about that so much. What the research says is that you really have to. It's the same. What the research says about what you can do, and it's no guarantee about any of it, is the same thing you need to do to be healthy anyway.
Okay.
Is to do the things to boost your immune system, right? It's to do it's the maintaining a healthy weight, right? The best thing that we have going for us is early detection. And I say that early detection, because that's really what saves lives. The American Cancer Society talks about screening starting at age 40, between 40 and 45. And they say optional. And I say to every Black woman I know, it's not optional for us. It's not. And that if you have a family history, talk with your primary care physician to get baseline mammogram even earlier than 40. And that's the best shot we have at saving lives, is detecting it early. Good news is that the breast cancer rates have decreased for white females by 46% over the last few years, but for Black females, 26%, 26. Again, we were talking about disparities and talking about those differences in health. That's another one. It's like, what's happening? And then the research talks about, A lot of times for women who look like me, we might present later. So we don't go early enough to do the early detection part, right? Our bodies may be may already be compromised because we're dealing with some other health challenge, right? All of those kind of things factor into how those disparities have come to be, but they are very real. And so that's why, the work that I do out in the community with Sister Alliance, with the Voices of Black Women, is to at least do my part. I can't, we can't fix it all, but we can do our part. So that's what I would encourage everybody: do your part. Just do your part. I tell people, you can do one message, and that is simple. 1 in 8, and I say 1 in 8, so we can't wait. 1 in 8 women will be diagnosed with breast cancer in our lifetime. 1 in 8. So I say to my sisters especially, 1 in 8, so we can't wait. What you waiting for? You got to get your mammogram every year. You got to be consistent with that.
Wow.
Yeah, you got to, because the mammogram can detect what you can't feel. And that's why you got to go early.
I agree.
Mm-hmm.
So my last question topic, I just want to make sure, because I don't think you talked about this too much either, but you being an entrepreneur, your home-based business model that builds teams, that promotes wellness, positive image, and cultural experiences around the world.
Yeah. Yay.
So yeah, please, I just want to make sure I'm getting all the major points out about you.
Oh, thank you.
So please talk about that. How did that come about? What does it all entail?
Okay, thank you. So when I retired, I was determined that I would get to enjoy more of the world. And so my husband and I love to travel. And he was in the Air Force, but that was before me, right? And so he's gotten to go to travel all over the world and experience all these different cultures, all these things. And I say, well, I want to go. So we are part of a lifestyle club, and information about that is on my website as well. Part of a lifestyle club in which we are able to show people how to live again, and to dream again, and to dream big, because a lot of us, once we get into that little comfort zone, we start to settle and we stop dreaming. And I'm so grateful. Like, one of my childhood dreams was to go to Paris and to see the Iron Lady, the Eiffel Tower. Got to go, and it was like magical. Loved it, loved it, loved it. And that's the experience in other cultures. If you don't have a chance to go out and to experience other people, other cultures, other foods, then you begin to think that that this is all there is. That little circle that you're in is all there is. And the world is amazing. The world is beautiful. There are other people. They're beautiful. Their foods and their differences. And that's what makes us all amazing. It is not that we're all the same, but we are all very different. And I just love experiencing that. And I like to show people how to do it, and do it in an affordable way. So that's kind of what the Lifestyle Club is all about. And I'm happy to share the specifics of how you get started with it. It's been amazing. Been a part of that for about 4 years now, I guess.
So how does it all come together, though?
It's
wellness,
a company.
Positive self-image, and cultural experiences.
Yeah.
I get why wellness and positive self-image go together, but how does it all come together?
So we have some all natural nutrition parts. That's the wellness part. And then the self-image, it has to do with just taking care of your skin, just skincare and all of that. So it's definitely a broader community of all these resources under one company that has just been amazing. So
wonderful.
Yeah. Thank you for asking about that.
Of course.
Yeah.
Of course.
I know we've talked a lot, so I didn't remember that part.
Well, you said it. We have talked a lot. I'm all out of questions.
Okay.
Is there any lasting comments that you would like to leave to the audience about yourself? We've talked about so many different topics. Anything that you want to leave the audience with? If not, it's okay.
Yeah, I guess I want to, again, thank you, Jess, for your time and giving me this opportunity just to share a little bit more about who I am and my pains and my passions. And I say to anyone out there that you have a purpose that's greater than yourself, and don't be afraid to step in it. Even if you're not sure, take the first step, and then the next step, and each step will become clearer. But don't just sit back on your gifts. Don't sit on your purpose, and leave your talents untapped. I just think that's really sad. Living is about taking the chance. It's about going out there and exploring something different, doing something new, and sometimes it really does make you smile and make you just grateful. And so yeah, I feel really good about all of the experiences, the hard stuff, the good stuff in my life. I'm a blessed woman. I really am a blessed woman because I'm still here.
Yes. Yeah. Still here.
I'm still here.
Amen.
All right.
Well, Dr. Barbara, it was a pleasure meeting you in person. I truly enjoyed this conversation. Thank you so much for your patience with all the questions. I know.
Oh, no, that was good.
But
you had me thinking.
Yeah, I just wanted to make sure that I really was able to, understand how your brain worked and also understand your past career and your career now. But yeah, thank you for taking the time to come. I know that it was a treacherous drive, but you made it. We're here, and we had a conversation, and I can't wait to post this and share it with the world. Wow. Thank you so much for your time.
God bless. Thank you so much.
Of course.
Continued success to you.
Thank you very much.
And I love what you're doing.
Thank you.
Yeah.
Thank you. Continued success to you as well.
Thank you.
Thank you.